Dr. Trimas, if I was interested in improving my lower facelift, what are my options?
Good question. There's various options for improving the lower face. There are several minimally invasive procedures such as liposuction, where you can just perform some removal of fat around the lower face and jawline and upper neck area and get some contouring of the neck and jaw area, and that's a nice way to do it. Then there goes to more aggressive procedures where you can do what we call minimally invasive facelifts, where you have limited dissection and just elevate the tissues of the lower face to resuspend them to the upper and mid face and cause some improvement along the neck and the jawline. And then depending on your age and depending on how much laxity you have or looseness of the skin of the soft tissues of the lower face, you can do a more extensive lift or facelift procedure.
What are the differences between all the lifts that we hear about quick lifts, the mini lifts, the cheek and neck lift, and the lunchtime lifts?
Excellent question. A lot of people, there's a lot of commercials out there and a lot of advertisements for all different types of lifting procedures. You know, quick lifts, lunchtime lifts, you know, cheek neck lifts that are limited, and other named lifts that are out there. And the bottom line is that they're procedures that we all do. There's nothing unique about these procedures. A lot of it is good marketing, and a lot of these companies are very reputable with their marketing, and it's a good way to get patients in there. However, as far as the procedure is concerned, it's really something that we all do. And for some folks, it may be an appropriate procedure where if they have a little bit of laxity of their soft tissues of their lower face and neck area, where a quick lift type of procedure or quick lifting type of procedure is appropriate for them. However, this procedure may not be appropriate for everybody. You know, there are people that have, you know, 3 chins or so much fat in their neck they look like a turkey, you know, from all the extra skin and soft tissue there. And those patients really need a more extensive lifting procedure to get the degree of improvement. You certainly can do a limited procedure. However, the problem with those limited procedures is that, as expected, there's going to be a limited degree of improvement. You may have a limited duration of healing and a quicker recovery. However, you've got to expect limited results and less longevity to those results. And as I said, you know, those types of procedures are appropriate for some people. There are some people that have a little bit of a looseness to their lower face and neck area and want improvement in that area. And I think those types of procedures are great for them. However, as I said, they're really all variations of a traditional facelift. When we do a traditional facelift, we do incisions around the front of the ear and the creases, behind the ear and into the hairline. When we do those limited lift procedures, we use very similar incisions. However, the amount of undermining, or meaning the amount of dissection or surgery underneath the skin, is more limited. And that allows for a faster recovery. And for some of those patients, those are appropriate procedures. But as I noted, most physicians are capable of doing all those types of procedures, whether we market one over the other. My approach to patients is I think, somewhat unique in that I think I try to find the type of lifting procedure that is really appropriate for the patient. So if you come in with a lot of heaviness to your neck, I may recommend a more extensive procedure. You may elect to have something that's a little bit less extensive, but you'll understand that that may result in a little bit less improvement. Also, I like to treat patients anatomically. Not everybody comes in with the same shaped face. Some people have more rounded face, some people have more angular faces, some people have longer necks. And those patients can't use the exact same procedure on every patient. Therefore, when I treat a patient and I call it a mini lift procedure, that's just a term I use, that really, in my mind, addresses what the patient needs. So in one patient, they may have more of an upward direction lift. Someone may have a backward direction lift if they have more looseness of their neck skin. They may have it more up and to the side. It just depends on how their particular aging takes place. And so I like to think of my lifting procedures as more directed towards the patient's needs.